So you're having chest pain and you're thinking to yourself, is this a heart attack? What does a heart attack feel like? And should I call 911? We're going to answer these questions in today's video. Welcome back everyone, I'm Dr. Kenny and we're going to talk about heart attacks today. First of all, if you're having severe crushing chest pain right now and it's worrying you, I would pause the video and go call 911. You can finish watching the video in the ambulance. But anyway, the purpose of this video is to talk about chest pain and when to be worried about it. I'm going to try to keep it very simple, straight to the point, easy to understand, and easy to remember. So let's go. What does a heart attack feel like? Well, classically, what we learn in medical school is that it feels like a pressure. It feels heavy and crushing. Some people say it's like an elephant sitting on their chest. You can have nausea, some people vomit, you can start sweating. The pain can travel down your arm or both arms even. Our textbook says if your pain is on the left side of your chest, it's worse with exertion and it's relieved with rest, then it's a high chance that could be coming from your heart. What do I mean by exertion? Well, anything that gets your heart going, like physical activity or emotional stress. A quick disclaimer though, some people, especially older women, might not feel pain from a heart attack. A couple times I saw some patients who had heart attacks and the only symptom they really had was some nausea and vomiting. This one patient I had, her only symptom was that she was just more tired than usual. The early warning signs of a heart attack sometimes are just really hard to tell. So if you have any nagging symptoms anywhere between really your mouth and your stomach and you're worried about it, then give your doctor a call. How do you know if you're not having a heart attack? Like if you have a quick sharp pain in your side and then it goes away after a few seconds, then it's probably not a heart attack. What I mean is a heart attack usually doesn't last a few seconds and it doesn't last for days and days. It's usually minutes. If your pain is getting better with activity or improves with exercise, then nah, that's probably not a heart attack. If your pain is very pinpoint, like you can point to it with one finger, like it's right there and nowhere else, then the chances of being a heart attack is also very slim. Okay, so we know that chest pain can be caused by a lot of things, and we know what a heart attack feels like. When should you call 911? When should you call an ambulance to get yourself to the hospital? If you have chest pain with any of the following, I will call 911. First off, if your pain gets worse with any kind of physical activity, like walking or climbing a flight of stairs, then I will call an ambulance. Number two, if you have pain and you have a hard time breathing, that's also something to be worried about. Number three, if you have chest pain and new or increasing swelling in your feet or your legs, that's also something to be worried about. And then number four, if your pain is so severe, like it's disabling you, you can't get anything done, you can't get on with your day. And number five, if your pain is new for you or has never happened before and you're worried about it, I wouldn't take the chances, call an ambulance. So this is a very important list. What I would do right now is pause the video, take a screenshot, and save it to your phone. So that next time if you're having chest pain or someone else you know is having chest pain, you can quickly pull up this list and refer to it. The last thing you want to do is worry about annoying people. I mean, if it's a heart attack, then it's a heart attack. Get some help. And also, remember to call an ambulance. Don't try to drive yourself to the hospital, because that could potentially be very dangerous. So when you get to the hospital, the doctors will see you, they'll run tests, they'll give you medicine, they'll try to figure out what's going on. You'll most likely get an EKG or an ECG. What that stands for is electrocardiogram. What we do is we put stickers around your heart so that we can measure the electrical activity of your heart. And this is a quick way to find out if you're having a heart attack. You'll probably also be getting multiple blood tests, and then most people will also get a stress test. A stress test is when we put you on a treadmill, or if you can't walk, then we inject you with medicine. But what we do is we try to get your heart to work harder and pump faster so that we can see how healthy it is. Obviously, if you had a heart attack and your heart was damaged, it won't perform as well as a healthy heart. So let's say that your chest pain is not being caused by your heart. Maybe it's your stomach or your lung or something else. Chest pain. Is it a heart attack? I work in the hospital and I get called to see patients with chest pain all the time. Just because you're having chest pain doesn't mean you're necessarily having a heart attack. Most of the time it turns out to be something less serious, like muscle soreness or anxiety or something like that. But it is your heart, so it's not something to take lightly. There are many other things that can cause chest pain. Let's go over a brief list of examples. You can have muscle soreness. You can have injuries to the area. Arthritis can cause pain. Stomach problems like acid reflux or heartburn. You can have lung problems. Maybe you have a lung infection, such as pneumonia. Maybe you have blood clots in the lung. You can have blood vessel problems in the area, like sometimes people have blood vessel tears. Rashes can cause chest pain, something like shingles. And then finally, depression, anxiety, and panic attacks can all cause and worsen chest pain. And then the list goes on, but I don't expect you guys to memorize all these things. Just keep in mind that chest pain can be caused by so many different things. What I would do is still go see your doctor to have those taken care of. If you're having muscle soreness, maybe you can get away with some pain medicine, or if you're having anxiety, then stress management. But the bottom line is, if you're having chest pain, then you're probably gonna end up seeing a doctor eventually. Okay, so that was a lot of information. Let's try to summarize what we talked about today. If you're having chest pain and you're worried about it, the first thing to do is stop, take a deep breath, let it out, and then go to your phone and pull up that list that I told you to take a screenshot of. But seriously, just go through the numbers one at a time, and if any of those are true, then I would call 911, get an ambulance, and get yourself to the hospital. If none of those are true, then there are so many things that it could be. I would still eventually make an appointment with your doctor just to find out what's going on. And that's pretty much it. Again, I know that was a lot of information, but I'm so glad you guys are trying to learn this because it's so important and you can really save lives with this information. What really worked for me, especially in medical school, and even today, if you're trying to learn something well, the one trick is repetition. If you really want to learn something, and if you really want it to stick, repetition. So if you need to, I would go back, rewind the video, watch it again. Also, please share it with your friends and your family, watch it together, have a discussion. Okay, in the comments below, let me know if this video made sense. Hopefully I didn't confuse you even more. That would be terrible. But let me know if it was helpful. Was it too little information? Was it too much information? That way in my future videos, I can keep them simple and straight to the point. Hit the subscribe button if you want to support me and see more videos like this. Thanks for watching. I'll see you next time.